Hi guys, this is Samir Islam, and I want to talk to you today about whether I think Reshape is the right procedure for you. Now during this presentation, I'm going to basically discuss who are the best candidates for Reshape and how we can make sure that we achieve the best weight loss for our patients. Now we know that obesity is a huge problem in the United States, and it's a nationwide epidemic. 33% of the United States population is considered obese. And if you take a look at this map of the United States, and in darker colors are the states that have more of an obesity epidemic. And if you look at Texas in particular, unfortunately we're in the 30 to 35% range of people in the state of Texas who have obesity. And so we know this is a huge problem, causing a lot of significant medical issues in the United States. Now, some of the other medical problems related to obesity include things like diabetes, heart problems, hypertension, and cancers as well. In fact, 13 different types of cancers have been associated with obesity, including esophageal cancer, colon cancer, breast cancer, uterine cancer, kidney cancer, stomach cancer, liver cancer, gallbladder cancer, pancreatic cancer, thyroid cancer, ovarian cancer, brain cancer, and lastly, blood cancer. So 13 different cancers have been associated with obesity-related health problems. Now, when a lot of patients come to see me about weight loss or Reshape, they understand the health problems that they may have with obesity. But the reasons that people have to want to lose weight are not necessarily health related alone. A lot of people tell me that they just want to play with their kids. They want to go to the park with them, they want to run around on the floor with them, they want to do normal things that parents can do with their kids, but they don't have the energy to do that, or they don't have the strength to do that because of their obesity. A lot of people are also tired whenever they do normal things because of the weight that they carry on their body. They don't want to feel that fatigue and just malaise and just feeling all around bad because of the weight that they have to carry. They want to have energy to do normal things that people can do, like go to the grocery store, go shopping, or even go for a walk. And for people who are obese or overweight, shopping can be very hard. There are certain sizes that don't fit you, or you have to order certain clothes to make sure that they have it in your size. And you may have to go to a specialty store to order the right clothes for you. And so this can be very embarrassing for a lot of our patients who have an overweight problem. Unfortunately, within our society, we don't look at obese people the same way that we look at people who are not obese. And so this can be very embarrassing for a lot of our patients. I've had patients tell me that they've had to buy more than one chair whenever they're flying on an airplane, or they have to be worried about where they sit because of some of the furniture that they may sit on could possibly break, or they may not be able to go to certain restaurants because they know that it may be difficult for them to find the right seat or the right setting for them to sit in. And so this can be a pretty embarrassing problem for a lot of our patients who are overweight. And unfortunately, a lot of patients who are overweight are stereotyped as either being lazy, unclean, just not caring about their health, which is completely wrong. But a lot of people unfortunately have this tendency to stereotype obese patients. Now, there are a couple of different ways that people can use to try to treat the obesity epidemic. And one of the first line options is medical treatment. Now, this is effective for some people, but not everybody. And unfortunately, only the best results in all the studies have only shown about a 7 to 10% reduction of weight. And so you're losing weight, but typically not enough to gain some of the benefits that you may have from losing that weight. And only 5% of the patients actually maintain that weight loss. So 95% of the people who go through medical therapy don't maintain the weight they've lost through this option. Now, surgery is also an option as well. This is a very effective treatment for people who have obesity. However, given the fact that we have surgery as an option, we still have a rising rate of obesity within the United States, and we know that this has not been sufficient enough alone to treat the obesity epidemic. And like anybody who goes under surgery, there are risks and benefits with going under surgery. There are complications that can occur with surgery. Not everyone who goes through surgery maintains the weight loss that they hope to get. And so like any procedure to which anyone can go into, there are risks and benefits with proceeding with a surgical option. And so this is where we're hoping Reshape can fit in. We're trying to capture those people who have not benefited from medical therapy, but who don't want a surgical treatment to be performed on them. And this is where I'm hoping that we can give you more idea of where you can fit and hopefully maintaining your weight loss goals. So Reshape is a very unique procedure. It's a new dual balloon technology. But in addition to the Reshape, we also offer a comprehensive program to hopefully maintain the weight loss for those people who undergo this particular procedure. We also offer a 1-year comprehensive program for people who are hoping to go through the weight loss program. And this has been shown to improve weight loss without the need for any type of surgical intervention. So what we do with Reshape is that we actually insert 2 balloons within the stomach under conscious sedation, so you're asleep during the procedure. These balloons actually take up physical space within the stomach, so you physically cannot eat as much as you used to. This is the only thing that is out there that is physically going to prevent you from eating as much as you did before. And with this process, we're able to maintain the weight loss. It takes about 10 or 15 minutes, all done outpatient, and we remove the balloon 6 months later, and people are able to maintain their weight loss. It's non-surgical, there's no altering in the anatomy whatsoever, and it's a completely outpatient procedure, taking 10 or 15 minutes, and you go home the same day. And so there are a lot of people who I think would benefit from Reshape, but there are certain people who I know for a fact would not benefit from the Reshape weight loss program. It's those people who have not tried to do other things like exercise or nutritional programs. If you do Reshape and you expect to lose weight without doing any other activity, it's not going to happen for you. And I tell all my patients this. Reshape is a tool, and like any tool that you have, it all depends on how you want to use that. So the best patients who can maximize benefiting from Reshape are those who have tried other things in the past, but they haven't worked. And the reason those are the best patients is because they have the motivation to know that when they have the balloon in there, other things are going to help them to lose the weight that they want to lose. If you're not committed to the program with Reshape, you are not going to lose the weight. So with the program, we offer 1 full year of comprehensive nutritional consultation. And that is extremely important in maintaining the weight loss and to keeping the weight loss off. This is one of the key components for Reshape. And the patients who benefit the best from this program are those who are committed to the nutritional component of Reshape. Anatomically, if you have previous stomach surgery, you have a large hiatal hernia, or if you're on blood thinners as well, this would be reasons to not perform Reshape, because unfortunately, these are the patients in which this procedure cannot be done. Now, the best patients for Reshape are those who are committed for a better life, those who have tried exercise or are willing to exercise, and those who are committed for a full nutritional program. The other best patient are those who have tried other things in the past. They have lost some weight, but they're not happy with the results. These patients would benefit greatly from having Reshape. And once again, it's those patients who have tried medical therapy but it hasn't worked, but who don't want to proceed with the surgical option. These are the patients in which we're able to help benefit to have maximize the most amount of weight. So thank you for listening to this video. If you have any questions, feel free to call our office or visit our website. We're happy to answer any questions you may have. Thanks and take care.